How many times have you tried to implement breathing into your treatment and your patient didn't understand the value and or you didn't get the results that you were looking for? This is a super common scenario, but the thing is, breathing can be crazy powerful when it's taught correctly. So in this video, I want to talk about 4 reasons why you should include a balloon into your treatment to improve your breathing exercises. Now, before we actually talk about the balloon, we need to talk about how to increase its perceived value. Here's a simple analogy and scenario that I like to put my patients through. If you find that you go to implement a balloon and they're really struggling to understand, why am I doing this? This is boring. I don't want to do this. I want to just move and sweat. Here's what you can say. Mr. or Mrs. Jones, if you wanted to increase the size of your biceps and or get it stronger, what would you do? And then they usually kind of do this motion, right? Bicep curl. And then you could follow up and say, what would you use and put in your hand? And then they say a dumbbell. That's when we just tell them, Mr. or Mrs. Jones, this is a dumbbell for your abs. If we want to get your abs stronger and get them to recruit more, to get more movement, to help get you out of pain, then we need to use a balloon just like you would use a dumbbell to improve the strength of your biceps. Normally, when they can link a balloon to a dumbbell, it now becomes a cool thing, right? Just like dumbbells and barbells, all these things are cool. This is now a cool tool. So if you're struggling to get that buy-in and that compliance when it comes to their exercises, use this analogy and it should definitely help. So the first reason why we should include balloons is that it's going to help move the rib cage. In the most simplest terms, if we can just get patients' rib cages moving, they're usually going to feel better 99% of the time. Most people have very, very rigid rib cages, and the balloon, now that we know is a dumbbell for our abs, is going to create more movement. And so we can get really intentional with how we want to use it, but we'll talk about that in a little bit. But in general, get the rib cage moving. A balloon will help you achieve that faster. The second reason why you want to include a balloon is that it's going to help your patients feel and contract their abs. Like we said, this is a dumbbell. It's providing resistance. But how many patients have you worked with that just say, I can't feel my abs. I can't feel my abs. Why is that? Well, they're normally in a position here that biomechanically makes it really hard to get leverage and actually contract the abs. But number two is that they don't have enough resistance and force and pressure to get the rib cage to move. So like we just talked about, balloons increase the movement of the rib cage. What's responsible for that? The abs. So the abs are going to contract, specifically the obliques, which a lot of people struggle to feel, and it's going to bring the ribs down and in. This is super advantageous for so many of our patients. The third reason why we should start to include balloons is that it's going to start to drive optimal breathing strategies. Have your patient take a breath, and what do you think you'll see? Usually we see a lot of belly breathing and minimal chest expansion. Once we can contract the abs and get the ribs to move, aka the 2 previous steps, that's when we then can start to drive optimal breathing mechanics. Because what they did is they just dropped the bucket handle down. They can now adequately maintain that tension to inhale and expand their lungs and expand their chest. Why is this good? Number one, most patients don't expand their lungs. The more we can get lung expansion, the happier the body's going to be. And number two, we do over 23,000 breaths per day. If we're doing that with minimal expansion from a chest and lung and not using the diaphragm correctly, it's going to feed poor mechanics over and over and over, and it's going to start to drive some of the symptoms as to why they're in front of you in the first place. So, optimal breathing patterns, super important. A balloon, a great way to do that because of the previous 2 steps. And last but definitely not least is that the result and the accumulation of all of this is that you'll start to see improvements in shoulder, internal, external, flexion, all of your range of motion. Why? Because we got the rib cage moving, we got the abs to get the ribs to go down, we are breathing better, keeping things more open compared to so compressed, and as a result, the appendicular follows the axial. So, if you have a patient that has limited range of motion, throw in a breathing drill. That also helps improve buy-in, by the way. Throw that in there. And now go to your workouts. Now go to your treatment. They're in such a better position because they have more available range. Their movement capacity is now significantly bigger. And as they go through that, start to build that time and time again. And over time, you start to change a pattern. So those are the 4 reasons as to why I would include a balloon in your treatments. Give it a shot the next time you're with a patient. If you have any specific questions, leave them below. Or check out the Clinical Coaching Foundations course, where we go into specific strategies and tactics as to how to use this for optimal results with our patients.